Hello, Dr. Mintz here. This is a case that's very interesting because there are a few findings. I'll go through the incidental findings here first. And these are just very good examples of cysts. And this is one honker of a renal cyst. Look how it distorts the normal anatomy of the renal cortex. So a very large cyst here. And sometimes they can be completely asymptomatic. And here's another one here, and then there's a smaller one up there, and then follow it down. Not much going on the right side. But look at the renal medulla, the renal pyramids on both sides. Look how they're high attenuation. Now this is one of the more high attenuation findings of that sort that I have seen, and you can get renal calcinosis that involves the medulla and that occurs actually more often than the cortex. But sometimes you also just get high attenuation because of the concentration gradient that the pyramids actually accomplish. Remember how there is an increase in the ionicity, the concentration, as you go from the renal cortex down toward and into the pyramids. So normally you may see some degree of higher attenuation in the region of the renal pyramids. In this case, it's more pronounced. It may also be early nephrocalcinosis, medullary nephrocalcinosis involving the pyramids and portions of the renal medulla. Okay, and a bunch of cysts and some high attenuation material here in the gallbladder. Now that could be stones or sludge, or it may be that the patient had an IV contrast injection recently, because even though that's primarily excreted by the kidneys, a small amount is often excreted by the liver into the biliary tract. So it's what sometimes they will describe, I will describe too, what they say is vicarious excretion of contrast into the gallbladder. It's not really vicarious in the sense of what that word ordinarily means. But the point is that this could be from recent IV contrast administration, or it could be from related to stones or sludge. Okay, so now we'll go down here a little bit farther, see if anything interesting here develops. That's Muffin barking in the background if you happen to hear him. Okay, so this is a male, and so that means when we're in this area, this is the prostate. Very important to recognize the prostate. Okay, this is the prostate, and then you get up above that, and you're in the urinary bladder. But look at this. What is this structure over here? Well, there's one over on this side, on the right, but as you go up higher, you see the one on the left is bigger, and it's denser. It actually is denser than most of the soft tissue there, even a little denser than muscle. So what is the structure? The structure, first of all, is seminal vesicle, and the seminal vesicle connects with the prostate on each side like this, and so does the one on the left that's larger. So I want you to know this anatomy. I want you to be able to look at a case like this and say, okay, this is the prostate. The prostate is big or it's not big, and then on a coronal image you can often see how well it's, if it is enhancing, no, I don't mean that, if it is actually impressing on the inferior aspect of the urinary bladder or not. And this is just actually, I just set it so it's just cutting above the prostate. So here's the bladder, and here's just a little bit of the top of the prostate there. So these should be the seminal vesicles. And you look and you say, this one's bigger and it's denser. Well, it's hemorrhagic changes in the left seminal vesicle, and apparently, and I think it was the only time I've ever seen that, but apparently that can occur from prostatitis or an infection of the seminal vesicle, and anything can become infected, and prostatitis is fairly common, can be extremely painful. Apparently it's one of the most painful things to go through, especially if you get a digital exam. If you give a patient a digital exam when they have prostatitis. Apparently it's extremely painful. But here anyway is, for the benefit of just the anatomy, you can see that here's the bottom of the urinary bladder, and off to each side you see a little bit of the seminal vesicles. And in this case, the seminal vesicles are of increased attenuation. The one on the left is, at least, and it's bigger, and that is due to hemorrhage. Unusual.